Assalamu alaikum. This is my last lecture on the development of the respiratory system. In the last lecture, as I told you, when the tracheoesophageal septum forms, then there is separation of the foregut into two parts, esophagus and the trachea. But in some anomalies, there is failure of the fusion of the tracheoesophageal fold into the tracheoesophageal septum. So, resultantly, there will be the incomplete separation of trachea and the esophagus. This is known as the tracheoesophageal fistula. This abnormality occurs with other mesodermal anomalies which are known as the vectoral, V for the vertebral, then anal, cardiac, esophageal, renal and limb anomalies. In these diagrams you can see here in the first diagram the normal anatomy where there is a separation of the foregut into the trachea and the esophagus. But when there is a failure of the fusion of the septum, then there is atresia with the distal fistula in some cases, or atresia with the double fistula, or you can see here atresia with the proximal fistula. In some cases, stenosis also occurs. These are some abnormalities related to the tracheoesophageal fistula. As you know that the respiratory system is divided into two parts, conducting part and the respiratory part. The conducting part is up to the terminal bronchioles, and starting from the respiratory bronchiole, the respiratory part starts. This is the table which is showing the different parts of the respiratory system and their histological differences. You will discuss them in detail in histology. Then comes to the maturation of the lungs. Maturation of the lungs mainly occur in four stages: pseudoglandular stage, canalical stage, terminal stage and alveolar period. Pseudoglandular stage extend from the 5th week of development to the 4th month. Canalical stage extend from 4th to 6th month, terminal from the 6th month to the birth, and alveolar period from the late fetal period to the childhood. Now we'll discuss them one by one. Number 1 stage of the maturation of the lungs is the pseudoglandular phase, which extends from the 5th week to the 4th month. In this stage, the terminal bronchioles are formed, simple columnar epithelium which resemble the exocrine gland. Respiration not possible in this case because there are no respiratory bronchiole or alveoli. In case of the canalicular phase, which extends from the 4th to the 6th month, terminal bronchioles are also there. 3 to 6 alveolar ducts are formed from the 2 or more respiratory bronchioles. In this diagram, you can see here, starting from the terminal bronchioles, there is the formation of the respiratory bronchiole, and then there are the 3 to 6 alveolar ducts. In this case, lung tissue is highly vascularized, as you can see in this diagram, the blood capillaries. So, the respiration becomes possible when some of the cells of the cuboidal respiratory bronchioles change into a thin flat cells. Surfactant synthesis has started. Respiratory and nervous system are still immature. These are the different stages of maturation of the lungs are shown: pseudoglandular, canalicular, saccular, alveolar. Terminal sac period. It extends from the 6th month to the birth, and in this case primitive pulmonary alveoli are formed with the type 1 and type 2 alveolar cells. Cells are intimately associated with the blood and the lymph capillaries. As you can see in this diagram, these alveoli have intimate contact with the blood capillaries. So, adequate gas exchange will occur and premature infant is able to survive in this stage. Now, the maturation of the lungs in the late fetal period to the childhood. During the last 2 months of the prenatal life and for several years thereafter, the number of terminal sacs increases steadily. In addition, cells lining the sacs, known as the type 1 alveolar epithelial cells, become thinner so that surrounding capillaries protrude into the alveolar sacs. As you can see in this diagram, the capillaries are protruding into the sacs. This intimate contact between epithelial and endothelial cells makes up the blood-air barrier. Mature alveoli are not present before birth. This must be in your mind that mature alveoli are not present before birth. This is the diagram showing the respiratory bronchiole and the formation of the alveoli and the alveolar ducts, and in the lower diagram you can see the alveoli structure with the type 1 and the type 2 pneumocytes, Clara cells, ciliated cells, free alveolar macrophages. Before birth, the lungs are full of fluid that contain high chloride concentration, little protein, some mucus from the bronchial glands, and surfactant from type 2 cells. The amount of surfactant in the fluid increases, particularly during the last 2 weeks before birth. Fetal breathing movements begin before birth, important for stimulating lung development and conditioning respiratory muscles. At birth, most of the lung fluid is rapidly resorbed by the blood and lymph capillaries, and a small amount is probably expelled via the trachea and bronchi during delivery. When the fluid is resorbed from alveolar sacs, surfactant remains deposited as a thin phospholipid coat on alveolar cell membrane. With air entering alveoli during the first breath, the surfactant coat prevents development of an air-water interface with high surface tension. Without the fatty surface layer, the alveoli would collapse during expiration, which is known as the atelectasis. The congenital anomalies of the respiratory system, the most common is the respiratory distress syndrome. This occurs mostly in the 2% of the cases, and it occurs when there is premature birth. And in the premature birth, as you know, that there is no formation of the surfactant, so no surface tension, increased alveolar surface tension will develop, and alveoli will collapse during expiration. It is also known as the hyaline membrane disease, and eosinophilic hyaline material is there. Some other anomalies are the congenital lung cyst and the errors in the pattern of the Devian. This was all about the development of the respiratory system. Thank you.